Okay, so this is the wonderful part about recording and technology. I deleted my meniscus video, which I was so upset about, but that's okay. We're going to film it again with not as pretty of a background, but that doesn't matter. It's all about what you guys are learning today anyway, right? So let me talk about the meniscus. Whoop. So the meniscus is one of the most commonly injured ligaments in the knee, and it is a cartilage like substance that is a circle on both sides. Now, the medial meniscus is on the inside here, and that is the most commonly torn meniscus. You have your lateral meniscus, it makes a little bit more congruency with the tibial plateau here. So, this is your tibia, this bone. And that's why it's not as commonly torn, whereas the medial meniscus, there's a lot more opportunity for tearing. You have that big C shape here. So this is what it looks like. It is the cushioning of the knee. So when you tear your meniscus, you can tear a radial tear, a longitudinal tear, a bucket handle tear where it actually flaps over this tibia, this bone itself. But I kept in the ACL and PCL here, so I'm just going to take them out so you can better see the meniscus. And again, meniscus is the cushioning of the knee. So we are going to go over a lot of exercises that would address the meniscus specifically, but to get you back to running. Running is a common aggravator for meniscus tears. So it is super crucial that we do specific things to prepare your body to be able to take on the load that running requires. Running is repetitive compression. So if you are not putting load the right way through these structures with your knee, you're going to feel that tear wherever you have it. But the beauty of meniscus tears is there's a lot of research now that shows that they can heal completely on their own without surgery, and there's actually a lot of good research that shows they recover better without surgery than they do with surgery. So I'm going to go over the specific meniscus tears as well because this is such a common injury, and I'm sure a lot of you guys who are doing this course now probably have a meniscus tear or have suffered from one or recovering from one, or maybe you even want to prevent having a meniscus tear getting back into running. So let's go over those specific ones. Okay, so here are the different types of meniscus tears. We have the normal meniscus here, and that is the medial side of the meniscus. This is the lateral meniscus. A radial tear is going kind of in the center, straight along like this. Longitudinal tear, it goes along the meniscus like this. A horizontal tear, you see a little bit more fraying, and it kind of works its way into the meniscus. Bucket handle tear, this is what I've been blessed to have 3 times, but that's where a flap actually occurs. So you can see there's almost like a hole in the meniscus, and this flap part here gets caught to the tibia. So that's where you feel like your knee is stuck in flexion, like you can't fully extend it, or it gets caught when you put it in a certain position. This requires surgery in most cases. I had to have surgery 3 times because I had a bucket handle tear of my meniscus, and they had to surgically repair it. The other 2 times I had it scoped out. So this one's not super fun to have. But then the parrot beak, it looks like this. It's almost like a flap. So it's a little bit fraying at the end here. And then the other one that's not mentioned in here that I like to make sure that we go over is a root tear of the meniscus, and that's where at the root of the meniscus there's a tear. So there's different types here, type 1, 2, 3, 4, 5. So type 1, very small and minor. 2, you have a complete tear of the root. 3 is complete tear of the root and a bucket handle tear at the same time. 4 is an oblique tear, so kind of at an angle. And then type 5 is a root avulsion fracture. So that's where like the actual bone itself, the tibia, attachment of the meniscus comes off as well. So these are different root tears depending on the type. So severity is where surgery might be required. But again, with meniscus tears, there's a lot of great research that shows you don't need surgery. I do recommend, however, if you've been struggling with this for a really long time and you've done all of your conservative treatment, I would then seek out professional help and see an orthopedic specialist to get this checked out. So don't wait, get it checked out. Worst case, they get an MRI, X-ray. Best case scenario, you still just need to continue your rehab. Worst case scenario, you may need surgery, but that is something that your orthopedic specialist can help you with.